Thanks for sticking with us. This week is Medical Laboratory Professionals Week, a time to celebrate lab staff who play a very important role in healthcare. Joining us right now is Dr. Walter Kelly. He's the American Red Cross of Utah's medical director. Thanks so much for being here.
Thanks so much for having me.
I think this is a cool week. It's a big title, but the people we're celebrating is so very important. So let's talk about the Red Cross, and when we talk about the blood donations and the blood supply, none of that is possible if you don't have people working in the lab to make sure that blood is safe and going where it needs to go.
Yeah, absolutely. So of course we have to have donors who show up, and we're very fortunate here in Utah to have that and wonderful support from the community. But as you say, without the laboratory professionals, starting with the phlebotomists who collect the blood, all the laboratory scientists who test the blood, and then of course our professionals in laboratory distribution that make sure the blood gets to the right patient at the right hospital at the right time, then you don't have this resource available for patients who need it.
And kind of talk to us about how many people are involved in that portion of the work.
Yeah, absolutely. So across the country we have almost 150 laboratories within the Red Cross system, with about 1,200 laboratory scientists and others who support all of those functions.
I like how you call them laboratory scientists, because they really are. That's cool. Let's talk about some of the other things that they do besides getting the blood, making sure it's ready, and then taking it where it needs to go. That in and of itself is a huge job, but they're doing more than that.
Yeah, absolutely. So we actually have specialized laboratories around the country. We have one here in Salt Lake who hospitals will actually send samples from patients so that we can identify very special blood transfusion needs. For example, we have a large Pacific Islander population here in Utah, and there's a very rare blood type. When most people think about blood, they think about, oh, I'm type A or I'm O positive, but there's many more blood types that we occasionally need to find for very particular patients. And it may take a laboratory scientist testing hundreds of units of blood to find one for a patient with particular need. For example, someone that's a Pacific Islander with a rare blood type, or individuals living with sickle cell disease, for example.
And for those people, that is so vital, important to their
it's
recovery.
It's the only way they survive.
That's incredible. Okay, let's talk about during the COVID-19 pandemic. Everybody shifted and changed a bit. So how did your teams do that?
Yeah, absolutely. So one of the biggest things that we did was testing for antibodies to find out if blood donors had recovered from COVID. There was a large investigation undertaken to try to see if we could find patients that transfusion with those antibodies would be helpful for. The biggest thing that we had to adjust to was the massive swings in the need for blood. So towards the beginning of the pandemic, many people wanted to get their surgeries done quickly so that they would have them done before the pandemic got worse. And then of course, as patients became very sick, we needed blood to be able to provide for patients who needed it. And then on the flip side to that, there were many surgeries that had to be postponed. And so then the need for blood decreased, and then as they were able to perform those surgeries again safely, the need for blood swung back up rather quickly. And so there was a lot of balance in the need to make sure that we collected enough blood to save lives, but at the same time never collected more than was necessary so that it expired.
Yeah, because you don't want it to go to waste.
Absolutely.
Dr. Walter Kelly joining us here. Thank you so much for talking about your laboratory scientists and all the good thing that they do for the American Red Cross. If you want to learn more, make a donation, do all that good stuff, please join them online, abc4.com. Thank you, Dr. Kelly. We'll be right back.